Good afternoon, colleagues. Let's make our way to our seats and welcome back to plenary. I hope you enjoyed your lunch. It has been 2 days since you gathered here for the opening of the 6th EMT Global Meeting. On Tuesday, our regional groups met to discuss their progress and challenges in implementing the EMT 2030 strategy. We will now have the opportunity to hear a report from them. So let's begin. Without further ado, I would like to welcome Mr. Sean Casey to tell us about the Western Pacific region. Sean?
Thanks very much, Camilla. Good afternoon, colleagues. I'm pleased to report back from the Western Pacific regional session. The Western Pacific region is comprised of 37 countries and areas, from Mongolia in the north to New Zealand in the south, with some of the largest and smallest countries and areas in the world. We have now 16 classified emergency medical teams in the Western Pacific, Type 1, fixed and mobile, Type 2, Type 3, and multiple specialized care teams. With a strong culture of solidarity, collaboration, and a word that I borrowed from a colleague from New Zealand today, capacity sharing, which is something that we really do quite extensively across our region. In our regional session on Tuesday, we had over 100 participants from at least 21 countries that we counted, including government representatives and NGOs. And our agenda was to review our progress and our plans against the EMT 2030 strategy, to introduce our new regional chair group, and map out the coming years, including specifically a look at climate change and emergency medical teams. We used an interactive approach to our regional session. So we had a brief presentation on progress so far, and then we broke up into what we called World Cafe. We did 2 rounds with 4 groups, each group on a specific topic. And everybody moved around, our 100 participants moved around a couple of rooms to look at how we can formalize national EMTs into national emergency frameworks or disaster response frameworks, how we can move towards national EMT validation and quality assurance, WASH challenges, including how to keep water liquid in Mongolia in the winter, to how to deal with desalination in Pacific Islands and everything in between. Interoperability and collaboration among NGO government teams and the private sector. Advancing specialized care teams, training and sharing learning across teams across the region. How we can strengthen chronic illness management and disability care in emergency medical teams, and of course, climate change. Sorry for a lot of text, but to put it in one slide, overall, we are well on track in the Western Pacific region towards the EMT 2030 objectives. We have emergency medical teams in place in nearly every country, which is a reflection of the investments that almost every country and some territories in the Western Pacific are making, strengthening health system resilience, and there's ongoing expansion in that space. So not only international teams and national teams, but quite a few countries working towards subnational provincial teams, really localizing response. We continue to expand collaborative training approaches, including very specific trainings on logistics and case management, water sanitation and hygiene, sustainable practices, and plans for EMTCC training. And some countries in our region have actually integrated EMTCC methodology into national policy and approaches. We want to continue to actively integrate innovation and innovative technologies, including, as I said, capacity sharing across our region. Part of that is a plan that we have to, pardon me, I've lost my voice this week, a plan to create a Hive platform for emergency medical teams, which is an online closed platform that all teams can use to collaborate, share resources, and undertake webinars, et cetera. We want to continue to strengthen our interoperability. We have a lot of teams using common training approaches, a lot of teams with common cache. we regularly have teams conducting training together, exercises together. There's been a lot of discussion this week on common information management systems. So unifying approaches as much as possible so teams can work together more effectively. We want to continue to strengthen national EMTs, including governance, making sure that all teams are reflected in national policy, have a budget line, even if it's a modest one, and then continue to expand sub-regionalization, so how teams can support their neighbors most effectively in peacetime and in emergency response. And of course, at the global level, strengthening national EMT development and quality assurance, working towards a national quality assurance and external evaluation validation model. I'm pleased to share that we've appointed our new regional chair group that reflects the diversity of our region. We have our incoming chair, the Philippines, with His Excellency the Secretary of Health joining us at the meeting this week. Our outgoing vice chair, the Pacific country of Samoa. The incoming vice chair, Papua New Guinea, which is a very active national EMT, and our new NGO representative, Pacifica Medical Association, with their PACMAT emergency medical team. This reflects the diversity of our region with classified international and national teams, high and middle income countries, government and NGO teams, and a shared commitment to strengthening preparedness in every country, providing quality and culturally appropriate care, and sharing capacities across the region as much as we can. Thank you very much.
Thank you, Sean, for such a comprehensive report. Now, to share insights from the Southeast Asia region, I'd like to welcome to stage Mrs. Sugi Pereira. Sugi, please.
Thank you very much, Camilla. So, Southeast Asia region. Okay. Exactly which area are we talking about? This is the other half of the map which Sean presented as the Western Pacific. 11 countries, but 25% of the global population sitting there. And we have been a region that has worked towards the EMT initiative since 2018. In 2018, we had our first regional consultation, and all member states agreed that this was important and worked towards a regional committee resolution the following year, which was adopted by all countries to strengthen the emergency workforce in the region. At the moment, we have one classified EMT, which is the Thai EMT, and we have 4 or even 5 now, which is following the mentorship process. The focus of our region have been primarily on strengthening national EMTs, and all countries have national EMTs and have been working towards that. And in fact, as of now, even 2 member states have endorsed their national EMT guidelines. I'll just take you to the resolution because what we did on Tuesday was primarily focused around this. In 2019, all member states agreed and endorsed a regional committee resolution which paved the way to strengthening the EMT initiative in our region. All countries agreed that strengthening EMTs is a high impact investment and paved the way to the establishment of the regional EMT working group. We had the 3rd EMT working group meeting on Tuesday, and the primary focus was on updating by the member states on the different aspects that the countries agreed to work on during their work on EMT, so which includes strengthening national EMT mechanisms, developing, implementing national plans, having a designated EMT focal points, which comprise the EMT working group in the region, establishing systems for quality assurance of EMTs, establishing national database, and also not forgetting getting enrolled with the WHO mentorship process. So we did 4 things. One is all countries updated the working group on their progress made. We also had the co-chairmanship change. For 24-26, we have Nepal and India who will be working as the co-chairs, with Thailand being the outgoing co-chair. We also discussed in depth about how we are going to take forward the EMT 2030 strategy in our region. And we agreed on our region's implementation plan of the EMT 2030 strategy. Our implementation plan comprises of activities aligned with the global strategy, along with the 4 priority areas, and you can see some of the elements that we agreed on last Tuesday. Further strengthening our working group, conducting national EMT workshops, which had been critical in strengthening the EMTs in the countries, civil-military coordination, simulation exercises, EMTCC trainings, using and leveraging on the multi-country EMT training center we have in Indonesia, supporting the development of national guidelines, facilitate EMT classifications, expand the roster of mentors in the region, and documenting and publishing. These are some of the things that we discussed and agreed to move forward with in line with the global strategy. We also discussed about the climate change and the EMT initiative, and all agree that this is something important and we need to integrate climate change considerations into our preparedness and response policies, strategies, plans, and actions. Finally, our way forward, which we agreed on, is the implementation plan will be finalized by the 15th of November, and we will implement the activities indicated in same. Further, we will include elements of this in the regional health emergency workforce strategy that we are developing for 25-30 period of time, and also include climate change considerations into both our draft implementation plan and the workforce strategy, and last but not least, the regional EMT working group to continue to support the countries to strengthen the EMT initiative in the region. With that, I stop. Thank you.
Thank you, Sugi. Now we turn to the European region. Please join me in welcoming Dr. Oleg Storochenko. Did I say it right? Almost.
Good afternoon, dear colleagues. I'm happy to report from a regional discussion of WHO European region. And we structured our 4-hour discussion around main aspects of implementation of global EMT 2030 strategy, and specifically regional EMT action plan that was endorsed by the decision of member states of WHO European region last week in Copenhagen. And I'm happy to see that community of practice, EMT community of practice in WHO European region is fully committed to the implementation of this action plan, and we see really great value in strengthening collaboration across our community of practice, raising attention at political level to the needs of EMT community of practice, and getting further support at the governmental level and also at the level of donors. I'm happy to say that in our region we have several tools that will help us to implement regional action plan in a systematic way. And I'm talking specifically about REACH, Regional European EMT Capabilities Hub, which is a training center which is expected to provide systematic support in capacity strengthening activities, in mentorship activities for national emergency medical teams, and being a driving force for the implementation of a regional action plan. And second tool is KeyMap, which is a knowledge and information management emergency platform, and we are going to implement both tools quite widely in coming years. One of the sessions was focused on national emergency medical teams because it's this concept is in the center of 2030 strategy, and it requires a certain change of mindset, and in a way, it's a paradigm shift. And during the discussion, it was also overwhelming consensus that we need to promote a balanced approach between strengthening national autonomy and developing national emergency medical teams with receiving a commitment for international solidarity to make sure that emergency medical teams are available to respond at local, national level as a priority, but also available for international deployments, so we can respond collectively as a community of practice. Third session was mainly about knowledge and information management platform, and we have received feedback from several partners in our region who already participated in piloting this tool for different activities, from mentorship and classification and to response activities. This tool was piloted during a recent MODEX simulation exercise run by European Commission. And there is also agreement across community of practice that perhaps this platform should serve for strengthening a regional community of practice. And we offer this tool as a hand to other regions. Please feel free to join us in this journey, and maybe we can start piloting this platform in other regions. And last but not least, there was a discussion, how can we work collectively to make sure that regional EMT action plan and therefore a global 2030 strategy are implemented in a systematic way. And of course, funds are always an issue. But maybe it's not quite right to start immediately with the funding. First, we need to start with advocacy, with sensitization of partners about EMT ideas, about philosophy behind emergency medical teams. And then we can progress with policy change, and this will bring us to more sustainable funding of EMT initiative. And we, as a WHO regional office, we developed several advocacy tools, and we also discussed how can we implement this approach in a systematic way. All in all, it was a really great meeting, and thank you again for your contribution and for your commitment. Thank you.
Thank you, Oleg. Now I'd like to call Mrs. Samar Hamoud to report on behalf of the Eastern Mediterranean region. Samar?
Thank you, Camilla. Good afternoon. I'm going to present a little bit of, as a start, a background of our region, the Eastern Mediterranean region. As you might know, our region comprises of 22 countries. Those countries are varying of economic, social, and political, as well as living conditions. And specifically, among those 22 countries, 9 have been classified by the World Bank as fragile or conflict-affected situations. In terms of disasters, 5 out of the 10 deadliest disasters that happened globally during 2022-2023 happened in the Eastern Mediterranean region. In terms of graded emergencies, currently we are responding to 16 graded emergencies, out of which 11 are grade 3. A little bit of progress about our regional implementation of the EMT strategy 2030. We are committed as a region for such implementation. In terms of regional progress, we are working towards establishing a regional governance structure. It is still in progress. We had our first regional meeting last June 2023, whereby we have gathered member states as well as partners in order to discuss and present the 2030 strategy, and we came up with specific recommendations that I will be sharing next. In terms of global classification, as you know, we don't have currently any specific team from our region as classified. But as our regional director in the opening ceremony on Tuesday has clearly supported it, it's coming soon. And we are working hard with our ongoing regional organizations, which are currently 8 of them. They are in the process of classification into making that happen. We had our first EMTCC course earlier this year in March 2024, where we have 27 participants attended and somehow graduating as receiving EMTCC coordination exposure. In terms of EMTCC activation, as you know, we have 3 ongoing emergencies where we have very well established EMTCCs in the region, responding to such emergencies. Namely, we're talking Gaza, we're talking Sudan, ongoing, Lebanon, and earlier we had Libya. We had our regional mentorship course where we have graduated 26 members that have been contributing to the pool of members of mentors from the region. And in terms of information management, through the EMTCC implementation to support Gaza response, we have worked on an agile and adaptation of the use of the MDS system. Specifically regarding our regional meeting for establishing and strengthening emergency medical teams in the EMR, and that was the main focus of our regional session on Tuesday afternoon, whereby we have gathered as countries from the region, partners, and discussed, presented the recommendations of that regional meeting, specifically the regional action plan that has been put in place and drafted. It was presented to the audience about reflecting on the 4 strategic objectives that are aligned with the 2030 EMT strategy. And an exercise of prioritization was implemented during the session itself. And of course, it wasn't completed during the session, so there is like a follow-up or a homework to take care after our global meeting, and that we're going to continue implementing it and working on it with our member states in order to review, endorse, and finalize, first of all, the regional action plan. And in terms of implementation, trying to finalize the prioritization exercise and identify those actions that we would be moving all together and implementing. What we have agreed upon or somehow collectively said, of course, our EMR action plan, it is representing a very bold commitment to strengthening resilience and enhancing our emergency response capabilities across the region. And its success in putting it forward and implementing it, it will all depend on our collective efforts and collaboration in order to be able to achieve those goals. Our second element that was discussed during the regional session was a presentation on the policy brief with respect to climate change and the EMT initiative. The initiative or the policy brief was very well accepted by the audience. Again, the exercise did not stop there, So the policy, because some of the participants, it was like their first exposure to the policy brief as a document. So the agreement was like to share once again the policy brief with the participants, with the member states, in order the consultation to continue and get more feedback. Of course, the commitment is there. The positive feedback about the engagement into responding and approving this policy brief has been collectively agreed upon. In terms of actions or reflections on that policy brief with respect to our region as EMRO, as the Eastern Mediterranean region, we know exactly that the climate change is posing an increasingly critical challenge, and it's influencing our WHO as well as the national approach to health emergency preparedness and response. And specifically, in the fragile and conflict-affected settings, which is a main component of our member states. WHO would be prioritizing the climate resilience with its health emergency framework and collaborating with the governments to build climate-adapted health systems. We don't have yet what we call maybe climate-smart EMT deployments at the regional level. Again, we are committed to integrate climate considerations into our policies and standards. Noting the several challenges in that, in terms of resource constraints, again, especially in conflict-affected and low-resource settings, and highlighting the need of multi-sectoral partnerships. As you may know, we have our WHA resolution, that was endorsed earlier this year in May 2024, and we would be working towards promoting action plans into integrating climate and health policies, aligning with that resolution in order to strengthen community resilience against climate-driven health crisis. And finally, exploring potential regional partnerships, and through targeting some funding initiatives, we would support climate adaptation in health systems. And thank you.
Thank you, Samar. Every time I go up and down the stairs, I think that it's a tripping opportunity. So I have 3 more to go. So far, I'm doing well. So now for an update on the region of the Americas, I call to stage Mrs. Luis de la Fuente. Luis, please.
Thank you very much. We would like to share what we have been discussing during our regional discussion. The first part was very focused to follow up how has been the implementation of the EMT 2030 strategy. I would like to share with you how is our progress in the different indicators that we are monitoring. So, respecting the first indicator, the countries adopting the EMT methodology, as of now, 10 countries have developed normatives and resolutions integrating the EMT methodology at national level, and 17 countries are building national EMT capacity and strengthening regional interoperability. Regarding the indicator number 2, events with quality assured EMT response, during 2024, we had 2 emergency response because of the Hurricane Beryl in July in Granada and Hurricane Helene in September in North Carolina and part of the coast of the US, where we had the deployment of national EMTs. Also, we have been covering different large events in mass gathering, where the national emergency medical teams were designed to be the medical post on standby to cover all the international participants in these events. One was in Antigua and Barbuda, the CIS-4, and the second one was in Cali, Colombia, in the COP16, that both were covered by national emergency medical teams. Regarding the indicator 3, countries with teams that apply the EMT methodology, as of now, we have 19 countries with national and regional teams that are, who are applying the EMT methodology. And the indicator 4, regarding the EMTs classified, now with the recent teams classified, we have 11 international EMTs classified in the region. And especially in the next months, we will have an increase in the number of EMTs type 2 with Mexico, Barbados, and US with the NGO Samaritan Purse, who are in the process to achieve the classification. What for the region will be a turning point because we will increase the capacity in surgical and inpatient. Regarding the indicator 5, we have 31 countries who have designated EMT national focal points. This is for us a key achievement since we have 35 countries, so we are expecting as soon as possible, we could have the whole region with national focal points designated by the Ministries of Health. Also, we have 9 military focal points, what is very important because it's most of the Ministry of Defense are starting to be more involved with the initiative. Also, we have the NGO advisory network established in the region, and we are with frequent meetings with them, improving the response in the region. Regarding the indicator 8, the partnership, we are establishing different partnership in the region. We have already a MOU signed with the Pan American and Iberic Federation of Critical Care, and with the George Washington School of Medicine and GSD, who are supporting us to strengthening the preparedness. Also, we have other NGOs and organizations like Fundación Samu Response and other partners who are supporting our initiative. Also, I would like to highlight here some experiences, like, for example, we have with the Spanish cooperation, where not only focus just in the financial support, but also providing technical cooperation and joining our effort, what is, I think, is a very good practice in a way to be, to have a higher impact in what we are doing. Regarding the indicator 7, health emergencies with CICOM, as of now, we have 15 countries who activated the CICOM, and also we are delivering specific kits to support the countries to set up these situation rooms to implement the methodology of CICOM. CICOM is our Spanish acronym for EMTCC. It's a medical coordination and information cell, and it's a little bit different approach that we are doing in the Americas, but fully aligned with the EMTCC concept. Also, we have the indicator 8, regarding the guidance for modularized specialized EMTs. We are pending in the next days, weeks, to publish the mobile operation theater kit. That is a guide and a technical note to support the setup of these capacities at the regional level. And also we have the network, all the collaborative network of community of practice who are keeping different regional discussions in supporting the implementation of the EMT initiative. The indicator 9, EMT training, we have conducted 40 CIMEX as of now, and 21,460 professionals have enrolled in our EMT online courses. And during 2024, we deployed 31 field technical missions. Indicator 10, we have already 6 digital platforms and tools developed. And indicator 11, still a gap and something that we need to strengthen it, and hoping that we could publish very soon different after-action reviews and documents that we are realizing. Regarding the policy brief, we decided that it's a very important topic, and we wanted to have this discussion with all the focal points. So we are scheduling a meeting in the next weeks where we could just bring up the discussion and have a more detailed discussion, and hoping we could get this feedback. Regarding what we already discussed was the challenge and the opportunities that we have found implementing the EMT 2030 strategy. Regarding the challenge, some of them were the changing of senior executive within the Ministry of Health, what sometimes is difficult because we have to start again with all the awareness and the efforts, financial constraints to maintain the operational support and the sustainability, the recruitment and retention of professionals, harmonizing all the validation of medical license, equipment gaps, multiple concurrent emergencies. This is very interesting because we are having emergency after emergency, what makes sometimes very hard to focus on preparedness and readiness because we are in permanent response. So also this is bringing some fatigue to the responders and the leaders that are in charge of the EMT implementation, as well as the evidence-based research that for us is a gap that we are working hard to enhance. Regarding the opportunities, legal frameworks are advancing. Recently, Colombia approved a national resolution adopting the EMT initiative, like the national framework to develop their EMTs and implement the initiative. And we have also an increasing in the EMTs classified. As you can see, we have already 11 and other comings. Capacity building through the simulation exercise has been a very good opportunity for us. CIMEX is a very good opportunity to put together everyone and test the capacities, the responders, decision makers, and everyone linked with the EMT initiative. And digital transformation, fostering innovation and respecting data sovereignty, as well as using coding good practice, is something that is, for us has been a very good opportunity. I would like to finish with this picture. Well, this is the, sorry. This is the people that is behind of everything that we are doing. So all this progress, everything we have been doing during all these years is because of all these people. They are who are making this progress in the Americas. I'm very proud to be part of them. And look at the top of the picture. This was the motto that we have in our last regional meeting in November 2023 in Mexico, is together we respond. And beyond the words, there is a strong statement from the region to commit, to trust each other, to team up, and to join efforts in preparedness, readiness, and response, and ensuring that our emergency medical teams could be ready to treat everyone. Because the success of EMT response is not about to compete to reach the patients first, but to collaborate to ensure that all of us could arrive timely and treat the most vulnerable patients together. So I hope that you could become ambassadors of our motto, together we respond, and this will not keep only in the Americas, or as global initiative, all of us could work together in this commitment. Thank you.
Thank you, Luis. And now for our last update, I would like to call on stage Dr. Jerry Jonas Mbasha, that will provide an update on behalf of the African region. Jerry?
I wish I could come straight after Emro. We are sharing everything. That's the only one region we are having the same border. They took some African countries, we took some Emro countries, so we are fine with, except that some diseases, we are still keeping them back to Africa regions. Anyway, so opening that, again, Africa regions, we are having 47 countries out of 54 for the entire continent. And to date, we are having 22 countries which has been able to start implementing some EMT initiatives. And finally, because of being too much happy, we didn't put the map here because we're still celebrating Senegal EMT, so which is the first one to be classified in Africa regions. And I was talking to the team, don't forget that classifications, remember that you still beat, now you've started the process of reclassifications. So it's not going to sleep, it's keeping the same standards which has been observed by the mentors and other externals teams which came to classify the teams. So Africa regions always being under different public health emergencies, natural disasters, includes epidemics, we are having man-made, major conflicts. Before we start talking about Ukraine and Syria, I think we have been through for a couple of years, decades, talking about Sahel regions and other countries having this heavy conflict going on. And now we are having complex emergencies happening in some of the African continents. So during the Africa region sessions, we have been able to look at 5 main, 6 points. Regarding the regional EMT, where we are committed to keep promoting buildings our nationals EMT across different countries in the regions. So our target for the 2030 global strategy remains 70%. But I was happy to hear from our colleague from Africa CDC. They want to make it 90%. So, which is good, and with a strong partnership, I'm quite sure we will be able to make it. Capacity buildings, it's one of the other key points. We are having now a blue book, a yellow book, which should be capitalized by countries to support them building their national EMT. The governance will remain the same. Nothing changed so far. So we are having Ethiopia, Botswana, Namibia, and regional teams, which will keep providing support to the regional governance. Our cross-regional collaborations, it's another aspect we will keep looking at. Again, as I've mentioned, we are having multi-faceted intervention strategies, and one of them is our response approach to emergencies. And we have witnessed the impact of using nationals EMT to some of the emergencies in Africa regions. But we will keep, of course, this additional hand reaching out to global network to support providing additional support. Institutional partnership, which is some things we will keep looking at. Now we are talking about Africa CDC, which is having a great advantage of bringing together the 54 countries for the Africa regions, in addition to those one already covered by WHO. We have the West African health organizations, which is already supporting most of the countries in West Africa. SADC in Southern African countries, and the ECAS mainly in Central Africa region. So these are actually the regional platforms which will be used to see how they can really continue to provide support to building national EMT. Strategic coordinations, this has been highlighted throughout different sessions, but again, we are looking at the already existing mechanism in our regions. We are talking about the Avoc Surge initiatives, which is already building some of the capacities in countries. We are talking about the rapid response teams, in addition to the traditional one that's gone, which is already providing a great support in the regions. The health cluster mechanism already activated in 13 countries in the Africa regions. And these initiatives, these platforms should be contributing to the global health emergency corps, which has been highlighted in one of the sessions. Political commitments, it's something very key which came up, and we understood that technicians may have that commitment to put in place some of the systems, mechanisms, but without clear political commitment, it won't be very easy. So leaderships will be some things we'll be looking at, reaching out to some of the political leaders, decision makers to support some of the initiatives related to EMT in our regions. Research, it's one of the topics which came out, and again, it has now been one of the key aspects. Wherever we have emergencies, operational research has proven how it can change the course of outbreak response or any other emergencies response. So having comprehensive research, having key data to support response on ground, and having this continuous learning approach should be very key. So talking about data, that's one of the aspects we should be able to look at with Euro regions and how we can touch on the key map platforms, which has been already implemented in your region, and see how we can have that strong mutual partnership to move forward also that aspect in the Africa regions. Now, in terms of sustainability of implementing EMT development, we have lots of existing structures that we are not really using, and this is an opportunity to see how we can capitalize these existing resources. Capacity enhancement and long-term plannings. We have witnessed from some of the EMT teams, mainly Senegal teams, that these long-term plannings should be one of the aspects to prioritize, and it gives sustainability when it comes to developing our nationals EMT. So our future focus didn't change too much when it's come to the support to the global strategy. Again, these regional integrations, it's one of the aspects we will keep looking at. Support classifications, and now I'm happy that we can start talking about reclassifications. And again, we have a clear approach within our regions, which is called a 10 steps approach, which should be key to support other nationals EMT to come up. Technology adoptions, we have participated in one of the sessions, and we've realized that we have a minimum capacity in our regions which can be capitalized to support some of the EMT interventions when it comes to technologies. So thank you very much. That's all from Africa regions.